We have spent decades cataloging what tobacco does to the lungs and the heart. However, there is a lack of public awareness regarding the direct path these same toxins take to the human eye. Historically, smoking was so culturally ingrained that cigarette brands were even endorsed by medical professionals. This normalization created a massive pool of long-term users who were often unaware of the ocular damage they were incurring daily. Modern data provides a clearer picture of that toll. Using the China-X electronic health records platform, researchers analyzed over 12 million patients to isolate how smoking impacts specific vision-threatening conditions. This chart illustrates risk ratios for smokers versus non-smokers. Smokers carry a 2.6 times higher risk for cataracts and double the risk for retinal occlusions. For age-related macular degeneration, incidence is 3.8% compared to 2.1% in non-smokers, a 3 to 5-fold increase in advanced stages. These statistics suggest that inhaled tobacco smoke reaches the eye in high enough concentrations to dismantle its internal structures. To see how that happens, we have to follow the toxins through the blood vessels. Ocular health depends on the choroid, a dense network of blood vessels providing the highest rates of blood flow in the human body. When nicotine and carbon monoxide enter the bloodstream, they disrupt nitric oxide activity. This triggers a vasoconstrictive response, narrowing the vessels in the choroid and restricting oxygen delivery. This forest plot measures the choroidal vascularity index, or CVI. Across multiple studies, there is a significant reduction in this index for smokers, proving that tobacco use causes a measurable drop in the eye's primary blood supply. This reduction in blood flow, paired with direct toxic exposure, creates an environment of intense oxidative stress within the lens. In the lens, oxidation pushes cholesterol molecules out of cell membranes, causing structural degradation. These gaps allow alpha-crystalline proteins to bind together. As they clump, the lens loses transparency, forming a cataract. The smoker's eye faces a chemical progression distinct from natural aging. It is a state where tissue is deprived of oxygen and proteins are forced to crystallize. Deeper in the eye, the retinal pigment epithelium, or RPE, acts as the essential support layer for the retina. Smokers accumulate high levels of cadmium, toxic amounts of hydroquinone, and acrolein within this layer. These toxins are not easily cleared and begin to build up in the tissue. This accumulation paralyzes the eye's natural waste-clearing systems. Macrophages, the cells responsible for cleaning debris, become dysfunctional and unable to maintain the RPE. This creates a buildup of toxic debris known as drusen. This material puts physical and chemical pressure on the light-sensing retinal cells above it. When this pressure becomes unbearable, the retinal cells undergo apoptosis, or programmed cell death. This leads to irreversible central vision loss in advanced AMD. Furthermore, the presence of these toxins can interfere with medical treatments. Patients who continue to smoke often show a poorer response to the drugs used to manage wet AMD. Smoking increases the statistical likelihood of earlier retinal damage, while biologically interfering with the therapies designed to stop it. Ocular blood flow begins to improve as soon as tobacco use stops. When nicotine and carbon monoxide are cleared, the vascular resistance in the choroid begins to normalize. Patients who stop smoking at the start of treatment for wet AMD show results almost equivalent to non-smokers. Long-term risk reduction takes more time. It requires 20 years of cessation for an ex-smoker's AMD risk to drop back to the baseline level. To assist this recovery, optimizing diet is necessary. Increasing intake of antioxidants, omega-3s, and vitamin C helps the eye manage the historical effects of oxidative stress. Systemic defenses are also required, such as managing blood pressure and diabetes. Because early drusen buildup is often asymptomatic, regular clinical screenings are the only way to detect damage before it impacts vision. The vascular health of the eye reflects the state of the entire body. Quitting smoking stops the cycle of oxygen deprivation and oxidative damage, preserving the ability to see.